Are you overpaying for your Medicare coverage? You're not alone. Thousands of people each year overpay for their Medicare coverage simply because they don't know all of their options. Today, we're going to uncover the most common Medicare overpayment mistakes. And be sure to stay to the end because I'm going to show you exactly how to go about saving money and stop overpaying for your Medicare coverage. But before we dive in, I've made a free Medicare cheat sheet, which you can download. Just click the link below and get your free Medicare cheat sheet today. So some common reasons people end up overpaying for their Medicare coverage. Reason number one, sticking with an overpriced Medicare supplement plan. The way the Medigap plans work is the benefits are standardized and each carrier charges a different price for the exact same plan. For example, Company A may be offering a Plan G for $200 a month, and Company B may be offering the same Plan G for $150 a month. Same plan, different premium. We see a ton of people who are overpaying for their plan and they just don't know it. Luckily, we're able to help a lot of people change carriers to lock in a lower premium on their Medigap plan. Another reason for overpaying for your coverage is being on the wrong Medicare Advantage plan. We talk to a lot of people who are on the wrong Advantage plan. Either the plan doesn't cover their medications or has massive out-of-pocket costs. So it's important to shop your Advantage plan to see if there's better options for you. Now, if this is confusing or you'd like some personal help, feel free to give us a call at the number below or click the link in the description to book a one-on-one free Medicare call with us. Reason number two for overpaying for your Medicare coverage is being on the wrong prescription drug plan, also known as a Part D plan. We get calls from folks all the time that did not shop their Part D plan during the annual enrollment period and then woke up in January and their premium went up $100 a month. So it's very important to shop your Part D plan each year to make sure you're on the correct plan for your medications and you're not overpaying for that plan. Reason number three would be ignoring Medicare savings programs. So the Medicare savings program is through the federal government and depends on your income. It's designed to help low-income Medicare beneficiaries. These programs, if you qualify for them, can help with your Part D drug co-payments, your Part B premium, and other out-of-pockets. I'm going to put a link in the description below so you can check out the Medicare savings program and see if you may qualify for it. Reason number four, paying a higher Medicare Part B premium amount and Part D premium amount due to IRMAA. Now, IRMAA stands for the Income-Related Monthly Adjustment Amount and can increase your Medicare Part B and your Medicare Part D premiums depending on what your income is. Now, the government looks back 2 years at your modified adjusted gross income and determines if you're going to have to pay an IRMAA based on your income 2 years ago. If you happen to sell assets or have an increase in income, you could be subject to an IRMAA, which again will increase your Part D and your Part B amounts. So how do you lower your Medicare costs? Well, there's a few ways to go about that. The first one is to shop your Medicare plan each year, whether it's Advantage or a supplement. The supplement plan can be shopped anytime throughout the year, subject to health underwriting, unless you live in a state that has special underwriting rules. So if your rate goes up or you think you're paying a high rate now, give us a call at the number below and we'll help you shop your rate to see if there's a lower premium available for you. If you have an Advantage plan, you can change your Advantage plan each year during annual enrollment period, also known as AEP, which is between October 15th and December 7th. In addition to that, there's another enrollment period for folks who have an Advantage plan. You can make a one-time change to your Medicare Advantage plan between January 1st and March 31st each year. You can change your Advantage plan to a different Advantage plan or go back to original Medicare and get a supplement plan during that time frame. For the Part D drug plan, you can only shop the Part D drug plan during annual enrollment period. There's not an additional enrollment period for the Part D plan if you're going from one Part D to another. So again, Part D can be shopped between October 15th and December 7th each year. You can work with a CPA or an experienced tax planner to project what your income is going to be moving forward because, again, Medicare does look back 2 years as far as the IRMAA goes. So some strategies are delaying Social Security. Social Security counts towards your modified adjusted gross income, whether it's taxed or not. So if you're not collecting Social Security and you don't mind delaying it a few years, that will affect or can affect if you're going to have an IRMAA or not based on what your income is going to be. Other things to consider are tax loss harvesting if you're going to be selling an asset, or if you can spread out income from a sale of an asset or other income source over a few years so your income doesn't jump up one year and cause you to go into an IRMAA bracket. And for the Medicare Savings Program, if you think you might qualify, check out the link below in the description to apply for that program through the federal government. So a couple of real life examples of folks we've helped in our agency. We had somebody last week that called us and was paying $400 a month for a Plan F, and we were able to move them to a Plan G at $150 a month. So that's $250 per month we were able to save them. Now, they did have to answer some basic health questions to make the change, but most folks can qualify if you're in overall good health. Now, if you live in a state that has a birthday rule or a special underwriting rule like Connecticut or New York, you can switch without doing the health underwriting. So to recap, the biggest mistakes we see people make when it comes to overpaying is being on the wrong Medicare plan, whether it's overpaying for your Medigap plan, like a Plan F, G, or N, being on the wrong Medicare Advantage plan, or being on the wrong prescription drug plan. Those are the most common ones. In addition to that, we see a lot of folks who have an IRMAA, which could potentially be avoided by working with a tax professional and employing tax strategies. And also folks who may qualify for the Medicare Savings Program and have not yet applied. If you're looking for free, personalized Medicare help, give us a call at the number below or use the link in the description below to book an appointment with us. Don't forget to click like and subscribe below to stay updated on all things Medicare. Thanks for watching the video, and we'll see you on the next one. Thank you.